there are three major concerns when we continue biologics during pregnancy. Concern number one is that a medication could be teratogenic or cause harm to the fetus. Concern number two is does it impact the mom? One way would be by increasing infection risk. But one of the things we also need to be concerned about is if we give somebody an immunosuppressive agent such as a biologic during pregnancy, is that going to have an impact on the infant after the infant is born in terms of the infant's ability to fight infection? I think the key take-home messages are that it's pretty reassuring that it looks like there's not an increased risk for infection for infants who are exposed to biologics during pregnancy, whether it's the first, second, or third trimester. It's a small studies. I mean, we need more and more information to substantiate these findings, but it's very encouraging. I think the size, just that we don't have enough samples of a particular medication. It wasn't like we had 500 pregnancies in which babies were exposed to abatacept, and then we can say abatacept is for sure in the clear. But overall, it's encouraging. There was one finding that was not the intent of the study that they found that I think warrants further exploration, and they did see a small signal. I mean, it wasn't statistically significant, but there was a suggestion that exposure to glucocorticoids in the third trimester may have had a slight increased risk of infection, and I think that needs to be explored further. I think exploring further the question of whether glucocorticoids may increase the risk of infection after the baby's born if the baby has been exposed to glucocorticoids in the third trimester is a very important question for us to answer. And I think more and more data, post-marketing surveillance data, so we can really clearly say, you know what, these medications are okay to give during pregnancy if they are, and it's low risk to the baby. One thing that this particular study was not designed to look at, but it's an important thing for clinicians to keep in mind is if we are giving giving moms immunosuppressive agents, especially later in pregnancy, there likely is a small risk to infants in terms of getting immunization. So no live vaccines, no BCG, probably in the first 6 months following birth. And that's, although that wasn't the point of the study, I don't want people to walk away saying, oh, and it's okay, we can do every single immunization. I think it's just we're getting more and more reassuring data that the medications we use to control disease during pregnancy are oftentimes safer than we thought. And I think one of the things that as clinicians we forget that uncontrolled disease, so for example uncontrolled rheumatoid arthritis during pregnancy is not good for the mom and is not good for the developing fetus. So we want to be able to have tools to safely treat our patients during pregnancy.